Everyone knows statins lower cholesterol. But if that's so clear, why is there still so much debate around them? Some call them lifesavers, others claim they're harmful. Today we'll find out who's right and what's really happening inside our blood vessels. But before we get to statins themselves, let's quickly recall how an atherosclerotic plaque actually forms. Every day, our blood vessels face various stresses and damaging influences. Oxidative stress, high blood sugar, insulin resistance, all these factors gradually injure the inner lining of the arteries. For the body, these micro-injuries act like an alarm signal. It rushes to patch the vulnerable spot as quickly as possible to protect the vessel wall from further damage. And this is exactly when cholesterol comes into play. Cholesterol passes through the damaged endothelium, the inner wall of the artery, into a layer called the intima, where it becomes oxidized. The damaged surface attracts macrophages, immune cells that rush in to help. They engulf the oxidized cholesterol through special receptors. But when there's too much of it, the macrophages become overloaded and turn into foam cells. These foam cells not only get damaged themselves, but they also sustain inflammation inside the vessel wall. Gradually, an atherosclerotic plaque forms around this site, a structure that always contains chronic inflammation. Over time, the plaque can grow, become unstable, and eventually rupture. When that happens, a blood clot forms, which can lead to an acute vascular event, such as a heart attack or a stroke. And this is exactly the problem humanity has been fighting for decades. For more than 30 years, we've had a powerful tool, statins, drugs that became a true breakthrough in preventing and treating cardiovascular diseases. In 2022, a study including patients both with and without cardiovascular disease showed that statin therapy was associated with a 28% reduction in the risk of death from any cause. A meta-analysis of randomized clinical trials published up to July 2021 found that in patients with cardiovascular disease, statins significantly reduced total cholesterol by about 33 milligrams per deciliter, LDL cholesterol, the so-called bad cholesterol, by about 29 milligrams per deciliter, triglycerides by about 15 milligrams per deciliter. At the same time, they increased HDL cholesterol, the good cholesterol, which plays a protective role. These findings are consistent with an earlier systematic review from 2008 that analyzed 103 clinical trials. It found that compared with placebo, statins consistently raise levels of good cholesterol and apolipoprotein, AI, a key protein involved in transporting cholesterol from blood vessels back to the liver. Remarkably, this beneficial effect persists even with long-term use. Interestingly, that review also reported an additional benefit, improved kidney function during statin therapy. If we look at other large reviews and meta-analyses, it becomes clear that statins do much more than simply lower cholesterol. They reduce inflammation in the vessel wall, improve endothelial function, stabilize plaques, and lower the risk of rupture. A review from 2020 showed that statins enhance endothelial performance, the health of the vessel's inner lining, and also influence smooth muscle cells, platelets, and even immune cells. Altogether, this reduces vascular inflammation. And this effect goes beyond cholesterol lowering. It modulates immune and cellular signaling as well. A large analysis of 35 randomized studies, including more than 26,000 participants, demonstrated that statins significantly lower C-reactive protein, a key marker of systemic inflammation. This effect occurs with both hydrophilic, water-soluble, and lipophilic, fat-soluble statins. Other studies show that statins reduce not only CRP, but also the activity of immune cells, T lymphocytes and monocytes, and decrease blood clotting tendency. Importantly, these effects happen independently of cholesterol levels. Finally, a meta-analysis from 2022 showed that in patients with cardiovascular disease, statins also lower another major inflammatory marker, tumor necrosis factor alpha. So statins are far more than just cholesterol drugs. They reduce vascular inflammation, stabilize plaques, limit clot formation, and decrease vessel permeability, all crucial in preventing heart attacks and strokes. Now let's see how cholesterol is made and where statins act. Imagine a small assembly line inside each cell producing cholesterol. It starts with acetyl coenzyme A, a molecule derived from fats and carbohydrates. After several steps, it turns into beta-hydroxy-beta-methylglutaryl coenzyme A. The next key enzyme, beta-hydroxy-beta-methylglutaryl coenzyme A reductase, converts it into mevalonate. And this is exactly where statins step in. They block this enzyme, slowing down the whole production line. With less mevalonate, fewer intermediate building blocks called isoprenes are produced, and less cholesterol is ultimately formed. But here's the catch. The mevalonate pathway produces not only cholesterol. From the same building blocks, the body also synthesizes other important molecules. Coenzyme Q10, or ubiquinone, essential for mitochondria to produce energy, dolichols, which are involved in protein assembly, and isoprenoid tails, which help proteins anchor in cell membranes. To make coenzyme Q10, the cell needs two components, the amino acid tyrosine and 10 isoprene units, both coming directly from the mevalonate pathway. This brings us to one of the potential side effects of statins. If statins reduce mevalonate production, there is also less raw material for coenzyme Q10 synthesis. As a result, in some people, blood levels of coenzyme Q10 may drop. So what happens when the body lacks coenzyme Q10? It plays a crucial role in producing energy inside cells. When its levels fall, cells literally start to starve for energy, and that can be felt throughout the body. The first symptoms are often weakness and chronic fatigue. Even routine activities feel harder. Muscle pain or cramps may appear because muscles are particularly sensitive to energy deficits. The heart is affected as well. It never stops working and needs a constant energy supply. Low coenzyme Q10 can lead to palpitations, reduced endurance, or shortness of breath. Some people also report memory or focus issues, since the brain is highly energy dependent. So coenzyme Q10 deficiency can manifest in many ways, from general fatigue to muscle and heart problems. A meta-analysis confirmed that statin therapy lowers blood coenzyme Q10 levels, regardless of whether the statin is lipophilic or hydrophilic, and regardless of dose or treatment duration. Some studies show that supplementing coenzyme Q10 in patients on statins can significantly reduce muscle symptoms, such as pain, weakness, or cramps. However, this approach is not yet a formal standard in statin therapy. These are not the only possible reactions. Some people may experience mild elevations in liver enzymes or digestive issues such as nausea, abdominal pain, diarrhea, or constipation. A small number may have slightly increased blood sugar. Less commonly, headaches, sleep problems, or skin rashes can occur. Rarely, hair loss or reduced libido has been reported. Yes, side effects can happen, but in most cases they are mild and reversible. The main rule: never self-medicate. So, statins are medications with proven benefits, but also some drawbacks. They truly lower cholesterol, reduce the risk of heart attack and stroke, and help control vascular inflammation. But they can also cause side effects, from mild muscle discomfort and fatigue to rarer but more serious reactions. That's why the final decision, whether you need statins, at what dose, and for how long, should always be made together with your doctor. Have you ever been prescribed statins? Share your experience and thoughts. What's your opinion about this therapy? Thanks for watching till the end. Let knowledge serve your health, and may your heart stay strong. If this video was helpful, don't forget to like and subscribe. More medical deep dives explained in simple language are on the way. See you in the next video.